Hello, good evening to everyone present here. I am Lenina Longcomer, currently pursuing my fellowship in Geriatric Mental Health Nursing in NIMHANS, and I will be the host for today's session on overview of Tele MANAS. Tele MANAS, that stands for Tele Mental Health Assistance and Networking Across States, is India's national tele-mental health program launched in 2022 by the Ministry of Health and Family Welfare with NIMHANS as the national coordinating center. It provides 24/7 toll-free services through counselors, psychologists, psychiatrists, ensuring mental health care is accessible and affordable to people across the country, and it involves all the multidisciplinary team in the mental health care setting. At the forefront of this initiative is Dr. G. Balamurugan, sir, who has completed his PhD and also MBA, and he is the Assistant Professor of Nursing at the National Apex Coordinating Center for Tele MANAS, NIMHANS. He is a Florence Nightingale Awardee 2024 and currently serves as the General Secretary of the Indian Society of Psychiatric Nurses. So Dr. Balamurugan, sir, has authored textbooks published extensively in national and international journals, guided research scholars, and has been a sought-after resource person at numerous conferences and workshops. With great pleasure, we now welcome Dr. G. Balamurugan, sir, as our distinguished speaker for today's session. Sir, I now hand over the remaining of the time to you. Thank you.
Good evening, doctor. Welcome.
Good evening, sir. Thank you very much for inviting. And thank you very much for all of your time going to spend with us for another 20 minutes. So I'll share my slides here. So kind of a brief discussion will be there for 10 to 15 minutes. And then we can have a QA sessions, question and answer. Yes. Ma'am, is my slide is visible?
Yes, doctor. You are. Yeah. Everything is pakka.
Yes, sir. Thank you. Thank you very much, sir.
Thank you, doctor.
Yes. So as I said, I am Dr. Balamurugan, working as Assistant Professor of Nursing in Tele MANAS for the last 2.5 years. And I'm very happy to share the Tele MANAS updates to this esteemed, experienced, learned individuals so that we can learn, and we are expecting a lot of inputs from your side to improve the system also. So what we do now, we'll discuss briefly on these areas, the mental health burden, how COVID-19 affected the mental health of Indian citizen, the overview of Tele MANAS, its objectives, and how it works. So if we see mental health service in our country, so basically the budget allocated to health is minimal. Within health, mental health is least prioritized. So because of this less priority, we are unable to meet the needs, because need is very huge in a country like 140 crore population. Mental need is very huge, but we are unable to meet all the needs of the individual who needs some kind of mental support. In addition to that, COVID has come, all of us, we know that increased the mental health issues, such as if you see, there is a huge hike in the anxiety and depression symptoms. It is about around 35% was increased during the period of COVID-19. Not only that, even after COVID, the COVID survivors are suffering with a lot of mental health concerns like anxiety disorder, depressive disorder, substance use, and stress and adjustment disorder. So on top of the existing mental health need, COVID is increased the difficulties and issues among the Indian population. So during COVID-19, NIMHANS developed a national psychosocial helpline. So through this as a kind of a phone number where we can get people from India, they can call to this number and get some kind of mental health support during the time of COVID-19. So we conducted this service in coordination with all the states and UTs. Within a period of 2 years, we received around 6 lakh calls. So this is a great experience for NIMHANS and Ministry and Government of India. So from this, what we understand is the basic mental health service can be delivered over phone. So previously, we didn't think that we can deliver over phone, but evidences were less. But this COVID-19 experience, we can say it is a blessings in disguise, where we learned that the mental health care, minimal, the basic mental health care can be delivered over phone. So with this experience, we thought of having a tele mental health services and incorporate this digital into national tele mental health program. So this is the first time in Indian independence history where the word mental health is much more highlighted in the year 2022-23 to tackle the increasing mental health issues in India. So in October 10th, 2022, the National Tele Mental Health Program was launched at NIMHANS, Bangalore in the name of Tele MANAS. So Tele MANAS stands for Tele Mental Health Assistance and Networking Across States. I repeat, it is mental health assistance and networking across states. So basically, it is going to be a digital arm of existing district mental health program. And subsequently, in December 8th, the Government of India launched the operational guidelines for Tele MANAS program with the main aim of tele mental health facilities across the country for 24/7 with a helpline support service number called 14416. So that is the national Tele MANAS number. I repeat, it is 14416. Our objective of this program are deliver accessible, not only that, timely mental health care to the needy individual, and also maintain the continuum of care, mental health care in the community. And most important point is refer the needy individual to the appropriate referral system. And also we have to increase the capacity of mental health care infrastructure in India. So with this objective, and we followed main three principles. The first one is accessibility, which means each and every individual in India have an access to mental health care. So this accessibility we made at free of cost, which means any person in distress, they can get the minimal mental health service at free of cost by dialing this 14416. That is reaching to us Tele MANAS. And affordability, as I told you, it is completely free. So there is no cost involved at the individual level, and it can be accessed anywhere in India with any kind of devices. It need not be a smartphone, even a basic feature phone it is used, we can dial, and from landline we can dial, and even public phone we can dial. So they can access from their home, from their room, wherever they are, affordable at free of cost and at their convenience. So whenever they want call, because it is available 24/7. There's no fixed
Yes, sir.
like, sir.
Sir, please go ahead, sir. Please go ahead.
Yes, sir. Yes, sir. So at the convenience of the individual. So with these three principles, the entire the program is designed. For example, if you see right now a person is having any illness or distress, the person needs to go to a hospital or a medical college or a tertiary care center like NIMHANS to get the treatment for mental illness. So there is a huge gap here. So because as I told you earlier, the need is very high, whereas the existing resources are less. So there is a huge gap in meeting these needs. So here only the Tele MANAS plays by playing a crucial role of bridging these two. So in person in distress, they can get immediate help and they can refer to the nearby healthcare facility. So let us briefly talk about how this Tele MANAS works. As I told you earlier, it is the program run by Ministry of Health and Family Welfare, Government of India. So there it constitutes three important subcommittees under the National Technical Advisory Group. One is mental health service delivery handled by NIMHANS. Second, IT architecture of the system handled by IIITB. And health system domain is handled by NHRC. Let's see one by one. So if you see here the functionality, how it works. So there are 53 cells all over India. So these 53 cells, we call it as Tele MANAS cells. So it depends upon the population of the state. We have operational guidelines instructed the states to set up the Tele MANAS cells. For example, in Karnataka, we have two cells, one in NIMHANS, another one in Dharwad, that is DIMHANS. Uttar Pradesh has 4 cells, and the union territories like Pondicherry has 1 cell. So like this depends upon the population. The 53 cells are already established. So these 53 cells are mentored by highly reputed national importance institutes like AIMS and Institute of Mental Health. So 23 mentoring institutes are mentoring all these 53 Tele MANAS cells. To have better coordination, all these systems are coordinated by 5 regional coordinating centers. So which includes in Northeast, Tejpur and IBAS, Delhi and Chandigarh, PGH Chandigarh, CIP Ranchi and South side NIMHANS itself will take care. And all these regional coordinating centers and 23 mentoring institutes and 53 cells, the entire system is coordinated by Apex Coordinating Center, that is NIMHANS. So from NIMHANS, we are part of the team, Apex Coordination team. So we are coordinating all this infrastructure and framework. As a mental service delivery domain, NIMHANS is responsible to, as I told you, collaborate with all the regional coordinating centers, mentoring institutes, and state cells. And we are developing innovative, digitally driven training models for the Tele MANAS counselors and also mental health professionals. And we develop content and deliver appropriately. And also we have to collaborate and monitor the Tele MANAS service in a daily basis. And we developed SOPs for difficult situations, and ethical legal issues will be guided by NIMHANS. And major task as an Apex Coordinating Center on a national level is information, communication, and education. So sharing this information to the 140 crore people, that is a major and humongous task for any program. And I take this opportunity to all the people who are attending here, please take this information. Tele MANAS is available 14416. And also we should carry out the research how the system is working, the effectiveness of this program. As an architecture domain, IIITB, that is International Institute of Information Technology, Bangalore. So they designed the architecture and the IVRS platform where the system, it is getting the phone calls. And also they provide 24/7 technical support. And also they monitor developments. And ultimately the entire system should be aligned with the Ayushman Bharat digital mission. So all the developments, what we are doing it is almost aligned with the national digital mission, Ayushman Bharat digital mission. The NHRC is the domain which takes care of resource mapping and also advise policies on the health system. And also in future, they direct us to integrate Ayush health system in the telemental program. So this is the heat map where we have all the 53 cells. And as I told you, the Tele MANAS cells, the Tele MANAS cells is manpowered by 2 different sets of people. One is called as Tele MANAS counselors. So Tele MANAS cell is a functional unit of Tele MANAS. In that, the first contact of any callers will be Tele MANAS counselors. Then within the cell, we have professionals that we call it as mental health professionals. They also will be recruited in Tele MANAS cells. This comes under tier 1. And tier 2 will be inpatient service. We'll see one by one. So this is what happens. If you call to Tele MANAS 14416, that call will be connected to IVRS system. So there we have to select the language. Suppose if you are in Bangalore, if you are dialing 14416, IVRS will ask you your language preference. Since it is in Karnataka, first will be Kannada and second will be English and Hindi. Like that, you have to select the number. Once the IVRS system, once you select the language, immediately it will connect to the trained counselors. So counselors in the sense, any graduates who completed their masters in psychology or psychiatry social work, or undergraduates, nursing, psychology, social work with 2 years of experience. So these counselors are recruited by the state governments and they will undergo vigorous training by NIMHANS team. Once the counselors are appointed after the training, so they will receive this call. So once we dial 14416, the call will be connected to IVRS. Once you select the language, to the selected language who is available at the counselor, so the call will be connected to the counselor. So in Tele MANAS, what we believe is our Tele MANAS trained counselors can handle around 80 to 85% of the distress. So if a person calls with mental distress, our Tele MANAS counselors can handle 80 to 85% of the callers. Suppose the Tele MANAS counselors feel the caller needs some additional professional support. So we have the facility where the call can be escalated to a mental health professionals, which includes a clinical psychologist, psychiatric social worker, psychiatric nurse, and a psychiatrist. So recently we launched video consultation also at the MHP level, mental specialist level, where the psychiatrists or MHPs can first have an audio-based counseling. If the MHPs felt this person needs to be consulted video mode, so that what we can do, the MHPs can initiate the video call. So directly the caller can connect to a mental professional. In a simple word, if I say, if you want to tell, from any nook and corner of India, in any one of the place, the person can dial 14416 at free of cost at any time. He can consult a psychiatrist in an online mode. So in a simple language, I would like to say. And again, what we believe is another 10 to 15% can be managed by mental professionals. However, some 5 to 10% of the callers, they need some inpatient care. They should visit the healthcare facility. So what the system operates here is, so immediately the callers will be connected to a tier 2 level. So tier 2 levels are nothing but the existing healthcare facilities, which will be a primary care center near to the caller, or medical college hospital, or a district hospital, or even NIMHANS like specialist hospital. So the caller will be, we will tell, since you are from here, the nearest hospital to you is this place. Please go and consult a consultant or MHPs in the particular hospital or healthcare facility. So this is the way the entire service is delivered. So our aim is anybody called or anybody dial this 14416, there should be minimum level of mental health service will be delivered. It may be from a counseling, brief counseling by the counselors, at this next level of consultation. Third, it may be referred to a nearby healthcare facility. And if you see here in October 2022, we launched this program, and we took more than 6 months to reach 1 lakh calls. In April 2023, we reached 1 lakh, but within a year, we reached 10 lakh calls. That is May 2024, we reached 10 lakh calls. This, as on today, we served 26.4, maybe by the time it may be 26.5 plus lakh calls. We served through this Tele MANAS existing service. So what kind of people are calling to this number? Any individual's mental health issues can call this number and get help. And any individual who wants to help a person with mental illness, it may be a caregiver, or maybe a person like you to want to support the neighbors or family members, and ASHA workers who is working in the community volunteers, as I told you, all of you. So whenever you're in need, you can call, or you want to help somebody in terms of mental concerns, you can call on behalf of them, or you can share this number so that they can also call. And other than that, the existing structure, like a primary care doctors and the PHCs and Ayush health providers and nurses, all these healthcare professionals can dial to 14416 to check whether the person, those who are with them, having any mental concerns or not. So we can do a kind of collaborative service from Tele MANAS and the existing healthcare facility. So what type of calls were received? This 26.4 lakh kind of, majorly we received calls related to sadness of mood. The person called, I'm feeling very sad. Then stress related calls, sleep disturbance, anxiety, and exam, especially in the month of February, March, April, we get a lot of calls related to exam. And also substance related calls. So these are very common, but they not limited to this. So we're getting a lot of other concerns also. Our counselors system is effectively supporting the people, those who are in need of any one of these kind of concerns. And for your information, so these are the few manuals developed by us, and it is freely available in Ministry website. But it is mainly for the system. So called facilitator manual for the counselors and point of care manuals and the course content for Tele MANAS counselors. So these are freely available. If you want, if you're interested, you can download it from the Ministry of Health and Family Welfare website. And with this, I end my that 15-20 minutes presentation. I think I am in time. And now I think we can exit.
Thank you, Doctor.
So now I would like to request all of you to please share your views, thoughts, doubts. And we are very happy to hear from all these experts. We need your inputs and suggestions to improve the system.
Doctor, thank you very much, Doctor. It was a wonderful, it was a wonderful lecture. Very, very extensively telling what is the way in which, how mental health people are, people who have some kind of distress or something connected with mental health are being helped with in a cost-effective manner.
Yes.
And anybody can call at any time. Doctor, see, my apprehension, my doubt, my thinking is that as it is available all 24 hours, all
Yes.
65 days a day. Yes.
Yes.
And it is how many languages it is available, Doctor?
Thank you, sir, for asking. I missed this information.
No
Thanks
problem,
for
no
asking
problem.
this question. It is available in 20 plus regional languages.
Yes, it started with around 40 languages.
Yes.
Now it has got increased to 20 languages, Doctor.
Yes, sir. 20
That's
plus
great.
languages.
That's great. So that almost all the major Indian languages are covered.
Yes, sir.
So that one can talk in their own language and express what is their need. Doctor, will it be possible? See, in fact, we tried to do that in an earlier seminar, but it was not possible.
Yes,
Can
sir.
you connect to 14416 now and
Yes.
just demonstrate how it happens?
Sir, I will be very happy. Any one of you want to try from your end?
Can I try it, Doctor?
Please, sir. Please try, sir.
I am just calling 14416 from myself.
Yes, sir.
So that, people will definitely love to hear that, because see, certain times they get a feeling that
Yes.
no, this number is not reachable or something like that.
Yes, sir. Yes, sir.
I'm calling 14416.
Yes, we'll keep it in speaker. Yes.
Yes, it has come.
Preferred language.
Select preferred your language.
Tele MANAS में आपका स्वागत है. कृपया अपनी पसंदीदा भाषा चुनें. कृपया रकाबी उत्तर मत दें. Press 2 for English. हिंदी के लिए.
So I have pressed 2 for English.
Yes, sir.
Hello.
हाँ,
ಮೇಡಮ್ ಸ್ವಲ್ಪ ಇಂಗ್ಲಿಷ್ ಮಾತಾಡ್ತೀರಾ? ನಾನು ಡಾಕ್ಟರ್ ಬಾಲಮುರುಗನ್ ಅವರು ನಮ್ಮೊಂದು ಪ್ರೋಗ್ರಾಮ್ ಒಂದು ಕಂಡಕ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. VMS ಪ್ರೋಗ್ರಾಮ್ ಒಂದು ಕಂಡಕ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ, ಅಲ್ಲಿಂದ ಕಾಲ್ ಮಾಡ್ತೇನೆ. ಹೌದಮ್ಮ. ಅದೇ ಸದಾ ಇದು ಡೆಮಾನ್ಸ್ಟ್ರೇಷನ್ ಪರ್ಪಸ್ ಮಾಡಿದ್ದೇನೆ. ಗೊತ್ತಾಯ್ತಾ? ಮೈ ನೇಮ್ ಇಸ್ ಜಂಬುನಾಥನ್ಮ. ಹೌದಮ್ಮ. My age is 77, ma. I'm from Bangalore, Bangalore, ma. Bangalore urban. Now, Dr. Balamurugan sir, or gotta tamka?
Balamurugan
NIMHANS. ಅವರೇ ಒಂದು ಪ್ರೋಗ್ರಾಮ್ ಕಂಡಕ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಆನ್ಲೈನ್. ಅಲ್ಲಿಂದ ಡೆಮಾನ್ಸ್ಟ್ರೇಷನ್ ಮಾಡಿದ್ದೇನೆ ಈ ಕಾಲು. ಇಲ್ಲ ಹೇಳಿಮ್ಮ, ಏನು ತೊಂದರೆವೇ ಇಲ್ಲ. ಏನು ತೊಂದರೆವೇ ಇಲ್ಲ. ಇಂಗ್ಲಿಷ್ ನಲ್ಲೇ ಹೇಳಿಬೇಕು. ಏನಂದ್ರೆ ಇದು ಪ್ರೋಗ್ರಾಮ್ ಇಂಗ್ಲಿಷ್ ನಲ್ಲಿ ಮಾತಾಡ್ತಾ ಇದ್ದಾರೆ, ಅದಕ್ಕೆ. ಗೊತ್ತಾಯ್ತಾ? Yeah.
So this is a Tele MANAS mental health helpline, which working all over India, sir.
Okay.
This is a 24/7 services.
Okay.
And I am the counselor speaking. And even we have a mental health professional and as well as psychiatrist.
Okay, ma'am.
So this is our tier 1 service.
Right, ma'am.
Anybody can get here tele-counseling.
Right, ma'am.
Whoever having some mental health issues like which can be work stress, family stress, relationship issues, or any addiction problems.
Okay, ma'am.
So students can get some memory issues, exam fears, like this, sir. Anybody can take tele services or tele counseling here.
Okay, ma'am.
This is our tier 1 service, sir.
Right,
If
ma'am.
anybody is having a mental health issues in severity,
Right,
so
ma'am.
if they want any treatment, sir, then we will suggest or refer them to tier 2.
Right, ma'am.
Which is a DMHP or any district hospital, Taluk hospital,
Right,
or
ma'am.
any medical institution.
Right, ma'am.
So we refer them to tier 2 if they are in need of that.
Okay, ma'am.
So this is our service, sir. Tele MANAS is working all over India. And it is 24/7 and it is free of cost. Anybody can call, sir.
Right, ma'am.
They can take service.
Thank you, ma'am. Thank you, ma'am. Where are you? Where are you from? Where are you sitting, ma'am? Where is your office, ma'am?
This is our protocol, sir. We cannot tell which is our exact.
Okay, which is your exact place? You are not supposed to tell. But then,
Yes.
okay, sorry. Do you at least disclose your name, ma'am?
No. That is also protocol, sir. We cannot disclose our name.
Okay.
But I am counselor speaking.
You are a counselor. So, like
Yeah.
that. Supposing I want to say now I have called you now. You have given me some counseling. Supposing I want some further information on this counseling.
Okay.
How do I get that, ma'am?
If it is in our this counseling is in counselor process, then we will only handle the call, sir.
Okay.
If it is severe,
Ah.
then we will transfer a call to MHP, sir.
That is right. No. What I'm saying is, you are good. See, supposing I'm saying, see, I'm having problems with regard to supposing I'm appearing for some examination.
Okay.
I have a problem. See, I am afraid of my exam. I am afraid that I may fail. Okay, you give me some input, and based on that, you are giving me enough confidence. I go and write the examination. So on the following day, I wanted to again talk to you because I have got one more examination.
One call back schedule, sir.
Ah.
So with your permission, we schedule the call back
Ah.
on your preferred date and time.
Okay.
That day we will do the call back.
Okay, you will yourself call back.
Yeah.
I see. That's great, ma. That's great.
Call back again. He himself call back to again. Then it is also okay, sir.
It is
You
also.
can call back us.
When I call you back, I may not reach you. I may reach some other counselor.
Yeah.
So that is why, supposing I like to reach you alone, how do I do that?
Then they have to tell, I want to speak past counselor.
Okay.
Then we will call or transfer call to same counselor.
I see. That's great, ma. That's great. So that helps. So because you know my case, I need not have to again explain the whole thing, isn't it?
Yeah.
Okay. Thank you. Great, ma. Great service. I appreciate your excellent reply, and it is very, very useful to all the people here. And Dr. Balamurugan is extremely happy that whatever he has stated is coming true in a live situation. Thank you, ma. Thank you. God bless you. God bless you. You too, ma. Have a nice day. Thank you. Thank you, doctor. See, now this helps people to definitely understand that whatever you are talking is truth, and nothing but truth. So that is why I wanted to have this demonstration, so that people understand that, and whatever be their concerns, they can now raise. Thank you, doctor. Thank you. Thanks for this. Any other person like to raise any other point? Please raise your hands or unmute and talk.
First, thank you very much, sir, for I think you are part of us. You are not from here. You are part of Tele MANAS. And we need like you people, sir. We need like you people. And I ask you to do like these calls and tell us how is the quality, how is going on, and help us to, if you give value feedback, that is most important for us, so that we can correct ourselves, improve, and there is always scope for improvement. We'll do that, sir.
Exactly, doctor. Exactly, doctor. In fact, in an earlier webinar like this,
Yes.
which we had in, right in NIMHANS,
Yes.
maybe around 2 years back,
Yes.
we tried, but we could not.
Yes.
We could not see. This time we were able to connect. Therefore,
Yes.
I wanted to establish to all of my people. Some of the
Yes.
people who are the
Sir, mute ಆಗಿದೆ sir.
what has happened is, in an earlier webinar, not it was a webinar, it was an open meeting,
Yes.
in-person meeting at NIMHANS. So, in fact, the lady was there. I am just forgetting her name. She was only coming and explaining. Then
Yes.
we tried to reach 14416, but we were not successful.
Yes.
Then people were telling, see, this is what is happening. We are not getting 14416. Then they said that, don't worry, it will be improved.
Yes.
So it is now demonstrated it is improved, doctor.
Thank you very much, sir.
Thank you,
I
doctor.
think
Thank you.
Ganesh sir is
Yes,
raised
sir.
his hand. Please, sir.
Yes,
Yeah,
sir.
Ganesh sir, come, sir, come.
Yeah. Sir, thank you very much. It is a really helpful information. And my question is, in case we are all senior citizens, anything
Yes.
can happen. Like suddenly we get a faintness, or we get some blankness when we are doing, or some very close friend of us got into some accident and we don't know what to do. We want to help them. I mean, how do we get that? Apart from mental health, will you be able to suggest this is how you should go ahead? Suppose, for example, my close friend is he's into some accident, or he is saying that I am having a heavy chest pain. Ganesh, please help me. I don't know. I just he got my call and I'm just in his call. Now I wanted to help him. He may be in a remote place or in the same place. How this Tele MANAS will help, sir, if it is possible?
Yes, sir. Yes, sir. So definitely, sir, we used to get this kind of calls, especially as you rightly said about chest pain and other things. And generally, what we suggest is we ask them to connect to a nearby facility if we know, or 108 and 104. So we'll try to connect the call to 108 is the ambulance service, so that immediately, suppose in case of accident, what you said, we can help the individual how to get this 108 service.
Excellent, sir. Excellent. Yeah.
Yes. And other things we'll try to connect with the 104 is the help. And I would like to share some of the other collaboration. What we did is one person having kind of self-harm thoughts. And what we tried is we tried to connect with the 112, that is the local police, Bangalore City Police, and that mobile vehicle service. So we connected this 112. The 112 reached the place where the person having self-harm thoughts. So they rescued the person and tried to connect to a person near to them, or to the place where they can be very safe. So we're trying to networking with all these services based on the calls we're trying to connecting, sir.
Oh, thank you very much. Actually, this kind of help happened.
Yes.
A neighbor of mine next to our house. Early mornings by 6 o'clock when I started walking, I found his missus has called me, sir, my husband is not okay. By the time I went there, almost he is actually expired. We couldn't find out whether he is expired or on that.
Yes,
Then we were trying for 10-15 minutes because 1018, some 108. We tried and finally we got in 15-20 minutes we got support.
Yes,
But
yes.
while getting the support, there are a lot of questions like
Yes.
we went to the hospital. I mean, when asked for the ambulance, they were asking, who are you, from where you're talking, have you checked with the person, have you touched the person? See, we were telling, sir, he is totally unconscious, we are anxious, and we need it. We give our address and whatever references. But then they finally connected to the doctor. Then doctor started asking questions. That itself took about 10 minutes.
Yes, yes, yes.
Then ambulance to come, it has become another 10 minutes, 20 minutes.
Yes, yes.
So Tele MANAS, I feel, will be immediate, so that you directly connect it to 108. It goes and then it is identifying the location and all is very good, sir.
Yes, yes, sir. Yes, sir.
That is definitely an additional information which will be very, very useful to all of us, sir.
Yes.
In
Yes.
fact, doctor, we have been talking about this 14416 to wherever it is possible.
Thank you, sir.
But yeah, we have been doing that. We have been regularly doing that. 14567 also. That definitely about this 144, this number also 14416. Like that, we have been talking. But
Yes.
today only I wanted to demonstrate to my people that what people are telling is not stories.
Yes.
It is real.
Yes,
It is
sir.
possible because they do not know who is calling.
Yes.
See, just like that, on a random basis we called, and
Yes.
people responded, and they exactly told whatever you have told.
Yes.
They did not tell anything extra. They did not minus anything. Everything exactly. Therefore,
Yes.
this is the proof, doctor,
Yes,
that
sir.
what we are talking in this VMS webinar. See, in fact, doctor, one thing we have been always telling that there is no marketing involved in VMS webinar. We don't market any product. We don't endorse any brand.
Yes.
But here we are now, what we are trying to do, sell is give is good information to the people,
Yes.
which will be very, very useful to them in VMS webinars.
Yes, sir.
So that has been today demonstrated, doctor. Thank you for that.
Thanks.
Thank you
Thank
for
you,
the
sir.
opportunity, doctor.
Yes, sir.
Thank
We
you.
are very thankful to this. I think we have some questions in the chat box.
Yeah. I have seen that. Yeah, Dr. Mahesh. Yeah, doctor. Yeah,
I have one question.
Sir,
Is
may
this
I ask?
available in?
but
Okay.
may I know who is on? Can you just hold on, ma? I will request Dr. Mahesh to first talk.
Sure.
Dr. Mahesh.
Yes, sir. Jamurathan sir, good afternoon.
Good afternoon, doctor.
Dr. Balamurugan sir, and very happy to listen to your conversation. The one important thing is you have only one helpline for mental health issues. Actually, there is a big burden of mental health issues, and what I request is it possible to have at least 3 to 4 helplines? And about this helpline, I think the whole team should introduce the system to Chandana Doordarshan, because Chandana Doordarshan will have very big network all over Karnataka. And so by providing the information to the public, it will be much more useful.
Yes, sir. Actually, thank you very much for your valuable input, sir. We are in tied up with the Chandana and our director, ma'am, Dr. Pratima Murthy, ma'am, and our principal investigator, Dr. Naveen Kumar C. They have given brief interviews wherever possible. Even in even Chandana, there is something called Talk to Experts. In that show, Chandana helped us to telecast this service. And regarding multiple mental service needs, I agree with you, sir. Then country like India, we need many more like this. So it's a long objective for us. I think we are having this right now. Probably in coming days, we'll go with some kind of more specialized services also, probably in coming years, actually.
Thank you, doctor.
Okay.
Yes, sir.
Thank you, sir. Thank you very much.
Okay, thank you, doctor. See, Madam Vatsalam, Madam, you wanted to raise something?
Yes.
Yeah,
Yes.
please go.
Is this available in all the schools and colleges, or are they aware of this number in all the schools and colleges?
Yes, ma'am. Actually, this is a very, very big challenge, as I told you, ma'am. In fact, taking this information to the needed individual, that is a big task to be done. But we are doing from our side wherever possible. We are doing it, ma'am. For example, in Bangalore, we have another project called STEAM, Educating School Teachers on Mental Health. So there we have covered almost around 160 schools. Sharing this Tele MANAS information, and in addition, around 23,000 plus students. But this is a drop in the ocean, actually. So we need to do a lot of work on this, and we are very happy to see last week the CBSE board, they given notification to all the CBSE schools in India to display the Tele MANAS details in their schools, in the notice boards, in classrooms, and conduct some kind of awareness activity. So that is from CBSE board. And 2 years before, from the University Grant Commission. So they have given notification to all the universities in India. Please share this information to the university students. But this is from the administrative side, the notifications and circulars have been issued. In the ground level, yes, ma'am, I agree with you. We have to do a lot of work. And there only we are asking all of your help. And as I told you, Jamurathan sir is not from VMS, from Tele MANAS. So now all of you are our Tele MANAS ambassadors. So please take this message to wherever possible you are. Just like Rotary, we are trying to tie up so that they are doing it from their level. So like this, we are trying on. So if all of us join hands together definitely we can reach to many people, ma'am.
No,
Okay,
yes,
sir.
sir.
Okay, sir. That is, yes.
That-
Yes, I appreciate that.
Yes, yes. And
Sir,
yes, ma'am.
Tell me, ma, who is that?
Sir, Bhuvneshwari. I am Bhuvneshwari, sir. It was
Bhuvneshwari. Yeah, tell me, ma, tell me.
Dr. Wonderful presentation. We are very much delighted to know that you are reaching so many people. But sir, one request from my side. I am surrounded with somewhere around 7 to 8 schools.
Yes,
So
ma'am.
immediately I would like to take up this news to the schools as well as teachers. So in which way I can be helpful to you? In case if you please let me know.
Yes, yes, ma'am. I will share my number in the chat box, ma'am. You can, I'll tell you, you can make a note, ma'am. 99. I'll type
Okay.
it 1632
99
1632
1632
4414.
4414.
Yeah, that is my number, ma'am. Yeah.
991632 4414. Am I right?
Yes, yes, ma'am. Yes, ma'am. I'm keeping it in the chat also.
Okay, sir.
If you're related to school means anytime you can call me. I'll connect you to the school related team is there. So they
Okay.
will come and deliver the entire session, ma'am.
Wow, wonderful, sir. Really, it's really wonderful. Thank you so much. And one more question from my side. Sir,
Yes,
since
ma'am.
the mental helpline is 14416,
Hmm.
one more you said 112 for the local police. So, should we connect directly to 112 or you want us to do 14416 first?
Ma'am, actually both are for different purpose, ma'am. So 14416 for mental health concerns. If you have anything feeling low or sad or stress, you can call us. So our counselors will help in managing your stress. But 112 is for actually police service, ma'am. So they are the patrol police service. That will be mainly helpful to maintain the law and order, other things in Bangalore city. So what I told, how we got help from them is, since they are the patrol, they will be in and around Bangalore, all the streets. So we could able to connect the nearby patrol service to the person who is having cell phone thoughts. So that's the way the government services in different places we can come together for a single cause.
So they are not connected with 14416.
No. That is the separate service, and this is separate service.
Right.
Based on
That
the
was
need,
the
we are
only
connecting.
point.
Yes,
Right.
yes.
Thank you so much, sir.
Yes,
Wonderful.
top
Thank
some
you.
question. Thank you, ma'am.
Very
Sir,
much great.
Namaste.
Namaste, sir.
Sir, I am Dr. Bachegowda, fast track trainer in milk and milk products. I am a
Yes.
ABGP Vice President, Karnataka Pranta.
Yes,
And we
sir.
are already started training on consumerism and food safety in high school and colleges.
Very good, sir.
So we have prepared a PPT presentations for
Yes, sir.
them when we go to schools and preferably for SSLC, PUC and college students.
Very
We
good.
already did it in Bangalore surrounding about 6-7 colleges, schools. So what type of PPTs do you have, ready-made PPTs, so that I can incorporate a few PPTs in that in our PowerPoint presentation?
Sir, definitely, sir. I will share. We have developed the information material on English, Hindi, and Kannada. So what I will do now, I think VMS team. I forgot her name actually. Lendina is here.
Sir, I can share Mr. Bachegowda's number to you, sir.
Yes, sir.
So that you can directly talk to him.
Yes, sir. Yes,
And
sir.
do that. Mr. Bachegowda has been doing this service for other matters also, sir.
Yes, yes.
So therefore, I think I will request him to directly connect with you.
Yes, sir.
So that it is easy.
Definitely, sir.
That way, is it okay, doctor?
Okay, sir. Okay, I'll anyway note it down. 119916324414.
Yeah.
Dr. Murugan,
Dr. Balamurugan. Dr.
Yes.
G.
Dr.
Balamurugan.
G. Balamurugan.
Yes, sir. Yes, sir.
Yeah, I'll store it. Then I'll raise a request through WhatsApp. So he may do so when he is free.
Yeah, that's what I'm saying. Is you just refer this meeting.
Yes.
And request him to send it. Therefore, he can send it across to you, so that you can add it in your PowerPoint.
Oh, sure.
And
Thank you.
And second thing is that, doctor, we
Yes,
can
sir.
do one thing more also.
Yes,
When
sir.
they go for a presentation like this, If somebody from your team can also join, that they normally they go within the district, within Bangalore only.
That
So
will be great, sir.
somebody from your team can also join. Therefore, they can also make a presentation for 15-20 minutes.
Definitely,
Will
sir.
that be
Definitely.
possible, Doctor?
Value addition to our presentations.
Yeah, Doctor, do you have such a team, Doctor?
Yes, we have a dedicated IEC team is there. So
Okay, Doctor.
We have some 4 to 5 members. Any one will come and share the information. That will be great.
Exactly, Doctor. Or you can do one more thing also. You can train some of us. We will also do the same job. No
so
problem.
now you are the trainer for us, sir, master trainer for us.
Yeah, kind of you, Doctor.
Yes,
Very
sir,
kind
yes,
of you.
Yes, sir. I think there are a few questions chat box, sir. I'll try to.
Please.
Top, what is the first question? This is the first question, no?
I'll just go to
that. Whether marital counseling will be conducted.
Yes,
Ma'am, as I told you earlier, no, ma'am, this service is mainly for the distress, not for the therapies actually, because the marital counseling needs more of in-person discussion. So, but what we do in Tele MANAS is, we'll try to reduce the distress first, then we'll try to connect them nearby service so that the couples are having concern, they can meet the person, get the appropriate service. So, I hope I answered for this question. And second is,
whether that is one thing.
Psychiatrists will prescribe medicine to anxiety-related problems. Saroja Bhai ma'am asked a very good question, ma'am. Thank you for asking this question. As I told you earlier, if the psychiatrist feel they need kind of online consultation, the psychiatrist will initiate the video consultation. So then after video consultation, if the psychiatrist feel, we have telemedicine guideline. As per Indian telemedicine guideline, prescription will be sent in a WhatsApp link, in an SMS. So the caller can click that link. So prescription will be downloaded in a phone. For that, we need at least a basic smartphone. In a feature phone, this link will not open. So we need a basic smartphone with the internet connection so that prescription can be given. But again, repeating, ma'am, it is bind to the law of India, telemedicine guidelines. And next is, yes, ma'am, let's put it down.
So they have thanked you for an excellent presentation. Yes, Doctor. Then at the end, there is a beautiful question, Doctor.
Yes, sir.
What are the challenges you faced till now?
Yes.
That's a beautiful question.
Yes. Thanks, Ramamani ma'am, for asking this very, very important question. The main challenge, as I told you earlier, ma'am, now previously, as I told you, there is a gap between need and service. Right now, the minimal service is available, but we are unable to reach the people who are in because they are not aware. So that is a big challenge what we are facing right now. That is information, sharing this available information to the needed individual. That is a very, very big challenge. And this is one of the opportunity, one initiative, so that we can, now I share to all, I can take all of your Tele MANAS ambassadors. So if you tell to at least 2 people, again, the 30 will become 60, 60 will become 180. It goes in it will multiplies that way. And second big challenge is setting up the system. Yes, because in India, it is a health in the concurrent table. So state and center should coordinate. So every state is unique in India. So the system coordinating with the states and making the uniformity is a big challenge. But from the Apex and help of Mentoring Institute, we are doing regular training and support so that we could able to maintain the minimum standard all over India. And third important challenge is, now we have established maintaining the quality of our service. So again, we are doing every bi-weekly continuing professional development courses for our counselors so that the quality of the counseling can be sustained. So these are the few challenges we are facing right now. And major challenge is reaching out the public, ma'am. That's a major challenge.
But Dr. C, in fact, probably her question was, sir, Joseph, sir, you wanted to ask something? Sir Joseph, sir. Sir, okay. Sir, the challenges from the, I mean, from this is your challenge of reaching people, you have told, doctor.
Yes,
But was there any instances where you were not, is there any instances where you wanted to help, but they could not be helped or something like that? Where,
Yes, sir. Yes, sir. Yes, a few incidents of that actually. Especially when we say when we have persons with self-harm and suicide thoughts. So few state councillors, they actually they were felt like they went to a feeling of guilt because I'm unable to help them. So what happened? So a person called and then he told, I feel I am not useful to this society. I'm going to end my life. So he said he cut the caller cut the call. So in this situation, as per the standard operating procedure, we have option to call back. So the council was trying to call the caller and it came as switched off. So the council was trying multiple times. Even though her duty finishes also, she didn't go home. Even she went go home, she was asking the next shift councillors. So did you get the caller? How is he? So like these incidents are there, sir. That is a challenge. But what we're trying to do now is, in this kind of situations, we have another procedure where the psychiatrist can request the technical team to unmask the number. Because suppose you are dialing now, Jamuna sir called to Tele MANAS, his mobile number are masked. His mobile number is not visible to the councillors. Council will have some 20-digit number, some alphabet number, something will be there. That number is completely concealed. So the anonymity is completely protected. So in that difficult situation, challenge situations, we have given permission to the psychiatrist. He is the consultant there. So he can request an email to the technical team. So technical team can unmask this number and then they can find out whether this person is available or they can get some help like what I told you earlier, this 112 or any other services nearby. So that is a big challenge, ma'am. Right now we force. And this I'd like to share as a big challenge, sir.
That is right. But can you unmatch the location also, doctor?
The location is not in our level, sir. That can be done only by the police.
By the police.
Police. They can immediately find out the location. That's why we take help from this 112 and 100. So then they have the capacity to find out the exact locations.
Exactly.
Language.
Doctor, please go ahead, doctor.
Yes, sir, Dr. Magesh.
Sir, I think in Tele MANAS you must be dealing patients who knows English and Kannada. And
Yes,
if you are able to handle patients with Hindi also, it will be much better also.
Yes, sir. So now that is another challenge, as Dr. Magesh sir told. Handling the migrant population is a big challenge for us right now. So, for example, basically, I am from Northeast or I am from Bihar. I came to Bangalore for work. So since I have the Bangalore mobile number, so the technology how it works means if I dial from Bangalore, it will connect to the Karnataka cells. Suppose I travel to Hosur, from there I am dialing, it will go to Tamil Nadu cell, it will not come to Karnataka cell. So like this, when it happens, so our counselors first will try to understand the language preference for them. And luckily we have few counselors, they are capable in handling multiple languages. Example, Tamil they can handle, in Karnataka I'm telling, Telugu they can handle, Hindi, and then in some part of regional languages, in Tulu also some counselors are equipped, they are capable of handling it. If the capacity is available in the cell.
Use artificial intelligence, AI intelligence, AI.
Yes. Now that is the next level we are working on it. As I told you, one point here is already we have Tele MANAS app already introduced. It is available in Android as well as OS platform. There you have a minimal service available. Now we can call from app, and we have few services like you can do some self check. You can engage yourself with some activity, some resources or what are nearby resources. Those things certainly we can navigate. We can do that simple work in that app. And we are working on the next level of app where, as Dr. Magesh rightly said, where we can try to use these AI as a kind of first level of chat, because what I understand, the young people in India, they prefer to use that Gen Z, prefer to use text than talk.
Talk, yes.
So we are working on that model also. Already we identified the need because of few other limitations. Just we are working on it.
What is the app name, sir? It is Play Store is available.
Yes, sir. Tele MANAS.
Tele
Telemanas.
MANAS.
Telemanas.
Oh, great. Thank you.
Yeah.
So you were telling something, doctor. Yeah, you are telling something.
Yes, sir. The text-based service is in pipeline, sir. Definitely, we won't miss that. So if you want to support the Gen Z, the text could be a better place. We are working on it. But how far that AI can support, that's a major thing we are just contemplating and brainstorming because we don't want to continue the chat for a long. So we want to connect the person to the nearby, connect at least to the Tele MANAS counselors. So that algorithm we are working on it, sir. Soon we'll get that.
Okay. That's great, doctor. That's great.
Yes, sir. Yes.
That's great. Okay. So any other doubts, sir? Any person? Any other doubt?
And Ramamani ma'am, very thanks ma'am. You asked can I support, can I donate? How is the funding happening for this? Ma'am, this is completely a central government program. So till 3 years, it is a centrally funded program. From this year onwards, it's a collaborative effort from state government and central government. And there is no direct funding option to this program. But however, NIMHANS has not only this, NIMHANS has other variety of service available, man. So the fund, if you want to donate, you can donate to NIMHANS. You can go to NIMHANS website. There you can donate option is there. There you can donate it, and it will be used for including Tele MANAS in other services also, ma'am.
Yeah, the NIMHANS is yes. You can donate money to many things to NIMHANS. There are so many programs going on in NIMHANS which we need funding. No doubt about it. That's a great news, now. Thank you.
Ma'am, you are with the stalwart, ma'am, CRC, sir. So, sir is the, we can say, pioneer in all these things. We are taking his vision and steps to a little forward, ma'am. Long way to go, actually.
But yeah, long way to go, but he is the torchbearer.
Yes, sir.
He is the torchbearer.
They are the wall, we can say, stalwarts in our field, and they are guiding us.
Yes, doctor.
Yes, sir.
Any other questions, sir? Anybody? Any other doubt? Last question. Yes, Dr. CRC is funding. Any other question? Doctor is also a busy doctor. So if there is no other question, I think time is also up. Time is also up.
Yes, sir. There's a last question. I think we'll take this question, sir. Tangaraju sir was asking, privacy is important to keep the patient. Many patients are visiting privately in district level medical practitioner. So as I told you, privacy, Tele MANAS, we adhere to the national policies like Data Privacy and Protection Act and Mental Health Care Act 2017. So in simple way, I can say, as I told you, the numbers are not recorded. The counselors will not know your number and you will not know the counselor, but the service will be delivered. And second point, none of the calls are recorded. As per the guideline, as per the policy, none of the calls are recorded so that you can feel free to share whatever you want. And third important point is, whatever discussion happened, it will be written as a notes, like a small points, so that next time when you call, the counselors will be clear, okay, this is what happened last time, so that I can take it forward. So numbers are not visible, and the second, the calls are not recorded. So this is the way we are maintaining the privacy.
And names are also not recorded.
Yeah, and second most important, names are not mandatory. Our counselors may ask, if you say, no, I don't want to tell the name, there is no harm in that. The counselors may ask your age and gender. If you say, no, I don't want to tell my age, there is no harm. It is not mandatory to tell your name and tell your age, gender, nothing is mandatory.
But you have told that police will be verifying if not available. That
Yes,
will
sir.
be much distract.
Yes,
much
yes, sir.
diversion.
Yes, very rightly you pointed out, sir. So as per this Mental Health Care Act, if it is an emergency, if it is an life-threatening situation for an individual, for others, that is the only time we can override this confidentiality. So in that case, where if I'm not turning up his number, he may end his life. So it is a life-threatening situation that is allowed in Mental Health Care Act 2017. So based on the act only we get able to perform. So that's the reason we take help. Even we can't do that. So we can take help from the already approved agency, that is police. So they will help us to do this.
My question is,
Yes, sir.
already is it stress?
Yes, sir.
Personal contact by a psychiatrist or a trained counselor will be useful to him.
Yes, sir.
A visit by an unknown person or police person will give more trouble to the vicinity.
Definitely, sir. Definitely, sir. We agree with you.
The people will ask why police has come. Who
Yes,
is
yes.
there? Like that. And
Yes, yes, sir.
moreover, many people doesn't want to visit a police person.
Correct, sir. So I agree with you, sir. That situations only decides actually. As I told you earlier, out of 80 to 85% of the calls received handled by Telemanas will be handled by our counselor only.
I have one person in Bangalore. He's more than 86, 87.
Yes,
He
sir.
will always say, I am going to go get suicide. I am getting suicide, like that. A very
Yes, sir.
known
Yes.
person. I disconnect with him because he is not living with his son, with his
Okay.
daughter.
Yes.
After a marriage of his wife, he is not cooperating with his daughter or son.
Yes, sir. Yes, sir.
He want to live independently as like in the Billy's past. That's a problem of an individual problem.
Correct, sir.
Always he will speak negative only.
Yes, sir. Yes, sir.
The settled person having one home, having the pension more than 70,000 like that. He's enjoying life like anything. But always he will speak like that. How can we counsel him?
Yes, sir. So
I
again,
have suggested him to visit NIMHANS. I will tell doctors.
that is
There
a
are a lot
great
of
option.
Kannada,
Yes, sir.
Tamil, English,
Yes, sir.
all languages. He can visit, but he will
Definitely, sir.
compete others.
So actually, that is what you said. What you did is the right way, sir. So you did a very fantastic job. So just encourage him to take help. That help
Yes.
can be in any form. Suppose he is hesitant to come to a hospital, at least he can call Telemanas.
He can meet a private doctor. He's
Yes.
no, money is not a problem.
Yes, sir.
Money is not a problem.
Yes.
Yeah, but he has to take decision.
Yes, sir. But with I think friends like you having like you is a great support. Actually, that's what I feel. We need.
Yes,
Yes.
we are supporting. We are supporting. We are conducting meetings. We are positive talking, positive loneliness. Most of the people are in loneliness. The stress is mainly loneliness.
Yes, sir.
But they are thinking that I am alone. What should we do? What else?
That time we need professional support, sir.
Even he has visited one home, stayed 1 month. Like there is no facilities as they have been.
Yes.
Today,
Yes, sir.
Supreme Court judge has observed beggars home. You could have read it.
Yes,
It is more
beggars
than
homes.
the
Basic amenity should be served.
prison-like condition.
Yes.
Because beggars home is different from old age home.
Correct.
There are paid home,
Yes.
free home, home constructed only for old age home.
Yes, sir.
Some rented without basic amenities homes.
Yes.
There are a lot of issues are there. We have to adjust with the people and live for the remaining period. That's the ultimate end.
Yes, sir.
Okay, doctor, sir, doctor's time is, time is already upset.
Yes, yes.
we
I
are-
am finished. I am
Yeah.
finishing.
Okay.
Just
Linda, madam,
one,
you can-
one
madam, you
just last question. It is
please,
not
please.
regarding Tele MANAS.
Okay.
Dr. Bachegowda mentioned something that he is doing some school and the food, about the food additives or whatever. He said something. I just want to know, since I am a pediatrician, I want to know about that. If he can give the number, I can contact Dr. Bachegowda.
Dr. Bachegowda. Okay, ma'am. Vatsala, madam. Hello. Vatsala, madam.
Yes, sir.
I will request him to send his number to you. No problem.
Okay, sir. Okay. Thank you, sir.
Okay.
Thank you. Thank you.
Madam, Linda, madam.
Hello, yes.
Yeah, you
Thank
can,
you.
you can, yes.
Okay,
Yeah.
okay. Thank you so much, sir, Dr. G. Balamurugan, sir, for your very comprehensive and clear talk on the overview of Tele MANAS, and for all the participants for your active participation. The link for this meeting will soon be shared in YouTube and will be shared in the respective groups. So you can, again, watch from there and also forward it to other people, your friends, your colleagues, so that they can watch it. So thank you so much, everyone, for attending. The meeting session has ended. Thank you.
Thank you
Thank you very
ma'am.
much.
Thanks to everyone. It was a very wonderful session. Thank you, doctor. See, we
Thank you,
look
sir.
forward to similar sessions in future also.